A huge study has demonstrated that often children go through different types of allergies as they progress through their childhood. Now, this is what's referred to as the allergic march. Now, we find in our practice where we're focusing on supplementation, lifestyle, dietary choices, that often this does not happen, or when patients transfer into our practice, how we're able to halt this march. Let's talk about it. Hey everybody, it's Dr. David. So, allergies, eczema, asthma, hives, these are all what are referred to as atopic conditions, okay? And they're involved with things like mast cells, histamine, IgE antibodies. Those are all involved in all of these different types of conditions. And it's interesting how in one person it could be one, because it doesn't mean that all of these things happen in everybody. And one person could have one type of symptoms and another person could have another symptoms. But this march here is that we're seeing often that there's this progression that first this one happens at this age, this age, this age. And we'll get into that in a little bit. But I also want to point out that I don't think that this is something that has to happen. Now, we know that there is a family connection. There's no doubt about that. Allergies run in families, all types of immune issues, autoimmunity as well, hyperinflammatory conditions. Now, of course, some of that may be because people live in similar situations, eat similar foods, and that could be part of it. But there's a genetic component that we're pretty darn sure about that as well. Now, besides the genetics, of course, we find, and here goes my occasional or more than occasional plug for vitamin D and zinc, but, having optimized zinc and vitamin D levels, which is the first thing that I go looking for, can often really kind of halt this, slow things down, treat it, reverse it. Now, also, besides those nutrients, more and more evidence is coming out that having a healthy gut microbiome, the environment of the intestines, the good guys that are growing, trying to minimize bad guys that could be growing there, that does make a big difference too. Okay. Now, there are other things that can be involved with getting an important microbiome. And, as you might know, we first get our good bacteria seated there, passing through the birth canal. So way, way, way back. Okay. Now, if a baby has a C-section, is born by C-section, or the mom had to take antibiotics at the time of delivery, or the baby had to go to the ICU and take antibiotics, that can disturb the good flora, can knock out the good guys, and if you're lucky, good guys grow back. If you're not so lucky, bad guys grow back, things like candida, clostridia. And so setting that at the very beginning is super important. One of the things that we do encourage moms to do is if they don't have a good vaginal delivery without and needing antibiotics, they can actually take their vaginal juices on their finger and give it to the baby. And that sounds really weird, except for when you think, well, isn't that what happens when the baby goes through the birth canal in the first place? That's called vaginal seeding, and it's a way of getting the baby's first probiotic. Okay, it's getting the flora that they would have been missing out on. So they can, and those are things that moms can do a few times a day during the first week of life in order to catch up, if you will. Okay, now there are also certain foods that certainly do seem to be more likely to trigger allergies. We know about peanuts, we know about dairy, we know about eggs. And so, of course, part of when we introduce baby foods, we always recommend doing them one at a time and giving several days to make sure that there's not an allergic reaction before you move on to the next food. And that's true for all introduction of foods, not just those. Okay. Now, we also do know that waiting on certain foods may even make allergies more likely. They've actually changed completely with peanuts. It used to be don't give your baby at all peanuts during the first year of life or even after that. And now it's actually found that earlier you bring it in, 6 to 9 months, the less likely your kid's going to develop peanut allergy. So that was a complete reversal that in terms of our recommendations from the Academy of Pediatrics since I've been a pediatrician 25 years. Now, it's also good to know most of the allergies to foods are based on the protein component, okay? Not the carbohydrate component, very rare, and even less so, very, very, very rare, the fat component. But of course, most foods do have some level of protein. I know people who are allergic to strawberries, and there's proteins obviously in the walls and all of the stuff in the cells itself, because you can't have no protein at all and be a being of any sort of animal or vegetable, I guess you could say. Now, so in terms of this allergic march itself, so this pattern, as I mentioned, it seems to be in a pretty predictable way. And there's this study that was in Pediatrics, which is the primary journal of the American Academy of Pediatrics. They looked at over 200,000 children over 21 years ending in 2020. So recent data here. And what they found is that often the condition itself was diagnosed at particular ages. So eczema, also known as atopic dermatitis, dry skin, itchy skin, scratch too much, it becomes inflamed, could become secondarily bacterial infected if you open the skin up. Okay. On average, that's starting about 4 months of age. Okay. And then food allergies. Okay. Just from the consuming, whether they're talking about, runny nose or other kind of allergies, but reactions specifically to foods. And again, that could be runny nose, that could be hives, it could be anaphylaxis, which is obviously the most dangerous, where there could be collapse of the cardiovascular system, etc. And that tends to happen around 13 months of age. Swelling of the airways, swelling of the lips. Those are other parts of anaphylaxis as well. Now, also asthma, or the term that I like to use is reactive airway disease, because it's very descriptive. The airways are reacting, causing constriction. And there's both spasming of the lungs as well as inflammation of the lungs. That typically starts to seeming to appear around 14 months as well. Okay. And then we go on to what we call hay fever, which is kind of interesting because most of the time it's not due to hay, and there's usually not a fever. So I don't know where they came up with that term for, but allergic rhinitis, where it's more just like the snotty nose kid. Right. And it's not a virus. It's kind of there all the time. Okay. And of course, that can be not just to foods, but to inhalants as well. So inhalants, whether it's indoor allergies or outdoor allergies, that's not common earlier on. It more is happening around 26 months is when we see that emerge. So a little after 2 years of life. And then there's a rare cases of something called eosinophilic esophagitis. And this typically happens closer to 3 years. And this could be really, really troublesome because it can interfere with anything that a kid eats. They're swallowing, it's inflammation of the esophagus. And that's one of the more severe things. So that impacts a kid's life, obviously, every day. And that could lead to them not wanting to eat, losing weight, not getting their nutrition down. So, of course, the hope is that we don't develop into that. But overall, 20% of all children are showing one of these types of allergies through the course of their early childhood. Okay, so why is this helpful? Why is this study important? Well, first of all, it's good because doctors and parents can know around the times that this certain allergies will show up, so they can kind of be on the lookout for them. Okay. And they, of course, can see whether their kid is then going through this march, whether this progression is happening. Because, of course, if you have 2 and then 3, we want to cut that off. We want to try and stop that from happening. Halt the march. Okay. So, of course, we find that there are things that can be done. Optimizing vitamin D and zinc levels. It's so important. Getting things in the middle part of reference ranges. We tinker with that a little bit, but that's always a good safe place if you don't get things at the bottom of the reference range, not at the high, but kind of in the middle or, middle, half to 2/3. That's always a great safe place to be when you're doing testing and supplementation. Okay, now all babies should be given vitamin D pretty much from birth, within the first couple of weeks. That's true. It is in baby formulas, but if you're breastfeeding, it's not there and there's not a lot there. I recommend everybody, even if they're bottle feeding, to give their kids 400, sometimes even 500 units of vitamin D. It's not going to be a dose that will overdose, and we want to get those vitamin D levels up. Of course, kids who are in the sun don't need as much as if the kid really is not in the sun much or in the shade, etc. So, but I do check every single patient, unless the parent is not interested, for their vitamin D and zinc levels at a year of age. Since we normally check for anemia, so we have to do a blood draw anyways. Then we're saying, hey, if you're gonna have to poke a kid, get those, and let's make sure that from the very beginning. But we even check these things in pregnant women. Okay, we check these in lactating women as well, because of course, if mom is low, then we know the baby's even getting less out of the breast milk. But if mom's levels are high, we know more is going to get through, especially because it's a fat soluble vitamin D, and so therefore the passage through the fat in the fatty part of the breast milk, so you can kind of get it along there. Okay, now since eczema often starts when foods are being introduced. Okay, that's why it's so important. We want to be paying attention from that part, because we say, start introducing foods for babies around 4 to 6 months, right? And so we also, again, introducing one thing at a time. I personally recommend doing vegetables before fruits, then doing meats. That's kind of the progression. I know that's a little bit out of the ordinary from what other doctors are saying. That's what I appreciate more, because I want the kids to get a good vegetable taking before they get the sweetness of the fruits. So that's why I say that. I also don't do a lot of grains during the introduction period, and I do not do rice cereal, which is so often the first one because of the concerns of arsenic, as I've discussed in this channel as well. Okay, so now you know about this allergic march. Now you know what to look for. So again, obviously seeking medical attention if you can, and hopefully if you're working with a functional medicine doctor who knows about these things and can test, and so can either prevent the march in the first place or can stop it along the way. Because I'll tell you, doing this type of work in the functional medicine field, I do not often see this march proceed. Again, most of our kids, I mean, our numbers for allergies, I think, is much less than 1 in 5 in the first place. But even when kids are transferred into our project and we're able to do these types of tests, that's usually all it takes. So there you go. Have a nice day.